Hello everybody. What I'd like to talk about today is the question I get about relapse. Patients will ask me in the beginning, okay, this sounds great, I love your idea, Dr. McCormick, I think this is going to be great for me, but what I want to know is, what happens when I'm done with care? Is it all going to go right back to where it was? And here's what the answer that I always tell them is, it depends on if you take care of it or not. Okay, discs, they're soft tissue. All right, and that's what we correct here is disc problems. And once we go through that rehydration process and we get the disc working again as good as it should be or as close to as good as it can be, we're going to ask you now to take care of it, to maintain it. So I'll go through on your last day of treatment a full rehydration program from things like, now here's the proper supplementation that you should take, or here's the proper stretches you should do, or if you do inflame or irritate your back, here's what you should do about it. And so every patient that graduates care in our office, I take them through a step-by-step process of what they need to do at that point to correct their spine. Now the research shows that there is a 7% relapse. We do have patients that come back after 1 or 2 years. They say, yeah, wow, my back, it's sore again. What happened? And I'll ask them things like, did you do the stretches that I gave you? Did you take the supplements that I gave you? Did you do the exercise that we went over? And almost invariably, it is no, no, and no. I'll ask them many times, has your posture been good? No, not really. They'll always tell me, yeah, I kind of started, slouching again and those kind of things. And every time that people go away from maintaining their spine, they risk relapse. Now, on the other hand, how about our patients who follow that step-by-step process once they graduate care? And guys, let me just make sure you understand, it's not that hard, okay? Basically, I'm saying things like, sit up tall. Don't twist your back when you bend over to pick something up. It's basic things like that that I go over with patients when they're done. But anyway, those that do follow that rehydration plan that I give them, I might see them 1 or 2 years later just come in to say hi. No pain, no symptoms, they're doing great and they're the happiest that they ever been. So that's two of the different situations that we see. Once people graduate, they may get that average 89% success rate. Some don't do anything for their spine, they don't do anything to maintain it, and over the next couple years, it may go back. And then you have your group of patients that are the happiest they've ever been. They took care of their back. They did those things that I went over, that I suggested that they do, and they don't have any pain or very minimal, and they have, all the function that they need. They can do whatever they want. So there you have it. Your chance of relapse depends on you. If you take care of your spine, it'll take care of you. If you don't, obviously the opposite occurs. I hope to hear from you guys soon. Thank you for your time.